Let's talk briefly about lichen sclerosus. Say what? Lichen, how do you spell it? L-I-C-H-E-N, lichen sclerosus, S-C-L-E-R-O-S-U-S. What the heck is lichen sclerosus? Well, let me put it very briefly. It's a skin condition that can affect women of pretty much any age, but it seems to have a predilection for postmenopausal women. And what happens is that the skin around the vagina, what we call the vulva, is prone to scarring. There's clitoral phimosis. That's when the foreskin of the clitoris tightens so that the skin cannot be pulled back to expose the head of the clitoris. And introital narrowing, meaning it's difficult to insert the penis or any object into the vagina because the opening has gotten tight and inelastic. Lichen sclerosus. And sometimes women don't realize that they have this condition until they develop persistent itching in this area, or pain with vaginal penetration, or some sort of discomfort in this area, which takes them to the gynecologist. And usually in the GYN office, the gynecologist can recognize it just based on its appearance. But if there's ever any concern about what is happening to the skin around the vagina, a biopsy is taken. So this can be quite distressing and embarrassing for women that have lichen sclerosus. It can interfere with their ability to have sex, and this is not due to menopause per se. Lichen sclerosus is a condition separate to the changes or symptoms associated with menopause, but tends to happen predominantly in menopausal women. The treatment for this condition is usually a topical steroid cream that gets placed on the area to reduce the inflammation and to reduce the itching and to reduce the amount of phimosis and tightening of the introitus. For the majority of the women, it has to be used on an ongoing basis, meaning that it's not like a urinary tract infection you treat it in the story. No, it's more like you treat the immediate effects, and once things have subsided, you go to a maintenance program, which usually means applying the cream once or twice a week. Now, if this doesn't work, there are other options available, and we are honestly still trying to understand what causes this. It appears to be among the autoimmune disorders, and so we need to know what triggers this in women, and therefore what I'm saying is we don't have all the answers. More research is needed. More research is being done. There are other medications and procedures currently being researched as other options for instead of long-term steroid application to the skin, which in and of itself can lead to thinning of the skin. So it would be ideal when we can identify what is triggering this autoimmune disorder in women or in people in general, and then being able to offer them a treatment that doesn't have any long-term consequences. So I'm saying to you, if you're a woman who is experiencing intractable, persistent, bothersome vulvar itching, you need to see a gynecologist. It may be something as simple to treat as a yeast infection, or it may be something else that has been undiagnosed, such as Lichen Sclerosus. Check it out. Ask your OBGYN. Follow up. This is Dr. Rahman. I'm just giving a brief health moment to make women aware. Take care of yourself. Goodbye.